Hello, and welcome to another episode of St. Jude in Five-ish. Mental illness has wide-reaching effects on an individual's education, employment, physical health, well-being, and relationships. And although there are many effective mental health interventions available, people often do not seek out the help and care they need. Providence St. Joseph Health is committed to changing that. And here today to share the work that is being done is Barry Ross, Regional Director of Community Health Investment. Thank you, Barry, so much for being with me today.
It's exciting to be here with you and with the audience.
So let's start by talking a little bit about one of the projects that I understand that we are involved in is the Be Well initiative, which includes a Be Well Center. Can you tell me a little bit about that initiative?
Yes, I'm really proud that our health system had taken on a leadership role in forming a county-wide public-private partnership to develop this initiative. There's many components to it, but the goal is to transform the system of mental health care in Orange County. 1 in 4 people are impacted by mental disorders in our county, and that includes from minor depression and anxiety to major disorders like bipolar disorder and schizophrenia. And our system today doesn't work for most people. So this initiative has several action items, including reducing mental health stigma, early intervention and prevention, crisis stabilization, and creation of 3 wellness hubs in the county. St. Jude is involved in many of the work groups with this initiative and also is investing with many other partners in building the first wellness hub that will provide a place where people can go if they're in crisis, if they have any mental health or substance use need. It will provide short-term crisis stabilization, withdrawal management for substance use, as well as short-term residential services there.
And where will that hub be located?
Well, the hub will be located near the Honda Center, but it will serve North Orange County, and there will be an outreach team that will go out into our community to help people get there.
And how is that hub different than what the services are that we're currently providing?
Currently, if you have a mental illness, often the only place to go is the emergency room, and that's not the right place to go. And so this will be a very comprehensive facility that can meet any need for anyone, regardless of insurance.
So are there any other initiatives like that we're also working on?
So we are one of the only counties in the country that is doing this. But as a hospital, there's several initiatives that we're involved in. One of them, which builds on what the well-being initiative is, the Be Well initiative, has to do with a stigma reduction campaign called Each My Matters. St. Jude, St. Joe's, and Mission Hospitals are activating the statewide campaign in Orange County in a big way. One of the things that we do is we have people that go out into the community, set up a table or a bench, and start talking to people about mental illness. Did you know that 58% of Americans do not want to work with someone with mental illness? Because since so much of it is not spoken about, what most people think of mental illness are people that are acting what people think of as crazy. That is a very small percentage of most of the individuals that have mental health issues. So we are trying to get people to talk, and our Facebook and our Twitter handle is @PromiseToTalk. I'd like to encourage our whole audience to like us, and they'll get a lot of resources and good information that they and their families can use to better deal with the stresses in their lives.
And they can also access more information on the St. Jude Medical Center website.
Yes.
I believe there's a page there. And so what about any projects that we're doing to work with our seniors in the community?
Yes, Heather, we know that there are 6 million seniors in the United States that have depression. So the way we're approaching it at St. Jude is we have started 2 depression support groups, and we're hoping to start a 3rd in Yorba Linda, where people can go on a regular basis and get support. We also do some short-term in-home counseling for the frail elderly. And we just started a lunch and laugh group to get people that may be isolated or lonely to come out and laugh.
And so, where do they get the material for the laughter?
Well, we could provide some jokes, but we encourage them to bring their own.
Oh, very creative.
Yes.
Very creative. And so, what about? Is there anything that we're doing to connect with the schools in the community? Is that something?
Yes, we believe that we need to prevent mental health and catch it early. So we have a project with the Fullerton School District where they do universal screening of all children, and then we have counselors that are student interns from Cal State Fullerton that we support to go into quite a few of the schools to provide individual and group counseling. We also have a liaison that helps connect families of children that need more support to a resource within their insurance or CalOptima plan. Many of them face barriers to get connected to services. And in La Habra, we've supported a social and emotional health curriculum.
So what we're really talking about doing is providing these services to the whole continuum, from the young to the old, and really providing all of the services that would encourage mental health and you know.
Yes, mental health affects everyone, regardless of income, regardless of race, regardless of age. Our hope is, as much as we can, that we can prevent it, and if we can't prevent it, that we can provide resources to people to get help.
Such a worthy endeavor. So thank you very much for being a part of that.
Thank you.
Just one more question before I let you go. What makes you bound out of bed every morning to come to work?
So I get to do what the Sisters of St. Joseph were charged to do back in 1650. They were told, go out into the community, find out the problems, and work with people to solve them. And I get to do that every day. And that is really rewarding for me.
Yeah, it's got to be so satisfying.
Yes.
Well, thank you so much for being with me today. I really appreciate it. And please join us at this year's Shamrock and Run, March 17th, supporting the Reach Foundation for Needy Children. St. Jude's own physical therapist, Valerie Owen, will be leading the warm-up. And thank you so much for watching St. Jude and Five-ish.